Well, I'm feeling so old, don't know what to do. I'm feeling so cold and I can't seem to move. I've got a feeling, hurts in my knee.
For centuries, man has written songs expressing their deepest, most intimate feelings, both good
Arthritis Blues
and bad. That's right, we're talking about arthritis. Next.
Alright, well, it affects 1 out of 3 middle-aged people in Western nations and approximately 63 to 85% of people over the age of 65. For those of us over 40, the leading culprit is stress and injuries, or so they say, and it is the second leading cause of work disability. What am I talking about? Arthritis. With those kinds of numbers, you or several people you know are being affected by arthritis. What do? What can you do? On today's show, we're going to get answers to an age-old problem. We're going to get to the root of arthritis and find out how we can put out the fire on those burning joints. Take a look.
What is arthritis? Pain and stiffness in your joints.
When your bones hurt. Your bones hurt.
It's where your fingers hurt. I don't know.
Because pain in your joints.
I would guess that it's an aching in the joints. Arthritis is like a thing with your joint or with your hands after gripping things too much.
Osteoporosis, inflammation.
What is arthritis?
It's where your wrist hurts.
Isn't it just like a wearing down of cartilage between your joints? That's the only thing I can think of. Snap! Snap! Snap!
Where your bones, I don't know, they start cramping and stuff.
I actually have it. I have something called Reiter's disease. It causes it in my hands and my knees and my ankles. So it just, I don't really know what causes it or anything. It just causes a stiffness to where it's harder to move. Like the more you move it, it kind of loosens up a little bit. So
arthritis is what it hurts if I move my hands. You can't play ball. Right. You can't.
When the muscle in your hand basically can't work and it can't operate like it used to.
It's joint pain.
At your 30s and 40s. You can get it at any age. I think at any age.
My daughter is 10 years old and she's being tested for rheumatoid arthritis right now.
Middle age, 35, 40.
If you're like in your 20s and maybe if you popped your knuckles a lot or did something like that, you could get it pretty fast, probably.
I believe it starts developing probably in your 60s, you know, when your joints and everything are really not as active as they used to be, so that's my opinion.
I think it's various things. If you're athletic, I think it develops a little earlier, sometimes in your 30s and 40s, and then for those who have it more genetically, it's later in life, like you said, the 60s.
Any age, I think, right? I don't know.
Usually old people get it more. The older their bones are, I guess.
I've had arthritis since I was, 6th grade? I think it was growing pains back then though, in my knees. When I got in the 6th, 7th grade, it started hurting. And they still do today, right? But I don't think it's arthritis though. It may be. I don't know. I don't know.
Usually like 65 when you get like, you no longer work. Yeah, you get like arthritis because you can't work. My grandmother, yes, she passed away, but she passed away like this. Yeah.
All right, well, while most don't taste good without it. My grandmother would take salt, put it in her hand, and she had horrible arthritis. She would take salt, put it in her hand, and when she could see a little mound, she would sprinkle it over her food, and then she would eat it. She wouldn't even Processed to death foods, and we all love these, everyone. You kill all the enzymes, and you're going to have acid being poured on your joints, and you're going to have a problem. Green peppers, turnips. All the Southerners just are going to write me nasty letters for saying don't eat turnips when you have arthritis. Eggplant. These are nightshade vegetables that you really should stay away from if you have arthritis, especially these things cooked. And then anything white, anything processed to death is going to cause you problems. And I had this little nurse come in, and she's hobbling around. I said, "What is wrong with you?" And she said, "I've got gout in my knees." And I said, "Oh, I bet I know what you eat." And she kind of looked at me, you know, gave me this evil eye. I said, kinds of medications. I told her, I said, stop those foods, go get some black cherry juice, you know, get some enzymes, do some of the things that are going to reverse that situation. About 3 or 4 days later, she came in, danced around. She said, "This is the most pain-free that I have been in years." Now, those are some of the things that we know that food plays a major role in joint pain. And certain medicines can cause arthritic type pain. Toxicity absolutely can make you feel like you are riddled with pain. And of course, certain diseases like liver disease, chronic fatigue, Epstein-Barr, as well as a whole lot more debilitating disorders. Now, while all of these are absolute root causes of pain and disorder in the body, there is one major player in the game of arthritis. And this same player has a whole lot to do with being over 40. When we hit 40, we simply don't have the same amount, the same ability, I should say, to digest our food, as well as just simply not having enough digestive enzymes. Could that be you? Well, get your pen and paper, because in a moment we're going to take a test to see if you could be enzyme deficient.
If you drink a lot of milk and you eat like a balanced diet, then that's probably protecting your body from a lot of stuff.
Yeah, if you have a good diet and you exercise, then that should help.
You can take medicine, pain pills, I guess.
To help prevent it, I guess you could not pop your knuckles.
Milk. I don't drink milk.
Advil?
I don't know anything, bro. I don't know, just eat fruits and vegetables.
Fruits and vegetables, protein, the right kind of medication that they give you for it. You like, no, you can drink joint juice, I guess. I don't know. Sure. This old lady that I work with, she has it.
I've seen the bracelets. I've seen the bracelets that are supposed to help and stuff. I haven't noticed any difference.
You mean those
the copper bracelets or whatever they are supposed to help arthritis? I haven't noticed any difference.
Naturally, I believe that some of the foods you eat, I believe that can have an effect on your body, as well as probably, you know, again, activity, making sure you're active, to make sure your joints are, you know, can handle certain loads and stresses. I think swimming helps as well, because it takes some of the stresses off your joints.
I would think exercising.
Or maybe stretching, because I know that's supposed to limber your joints and things like that.
Vitamin D. Vitamin C. Yeah, we'll go with vitamin.
Take anti-inflammatory. Try to straighten out your hand, but you can't, no, because like the medicine doesn't help. It like keeps the hand like straight, unstraight.
Are you at risk for arthritis? Answer yes to just some of the questions from the enzyme deficiency test, and you just might be. Do you suffer from depression, mood swings, allergies, PMS, fatigue, or inflammation? How about back weakness, constipation, high blood pressure, insomnia, and others? These are just a few of the symptoms that signal a pre-arthritic condition. For a complete list of syndromes common to enzyme deficiency, log on to our website at ValerieSaxonMinistries.com.
Well, if you were answering yes to some of the questions asked, get ready, because now the test begins. I want you to mark these down. When I call them out, you make a little check mark if this is you. Do you have breaking out of the skin, rashes, hypoglycemia, depression, mood swings, allergies, PMS, hot flashes, fatigue, cold hands and feet, neck and shoulder aches, inflammation? If you answered yes to 3 or more of these symptoms, you most likely have an amylase deficiency. How about back weakness, fungal forms, constipation, high blood pressure, insomnia, hearing problems, parasites, gum disorders, gingivitis? If you answered yes to 3 or more of these symptoms, you most likely have a protease deficiency. How about aching feet, arthritis, bladder problems, cystitis, acne, gallbladder stress, gallstones, hay fever, prostate problems, that's not for women, psoriasis, urinary weakness, constipation, diarrhea, heart problems? If you answered yes to 3 or more of these symptoms, you most likely have a lipase deficiency. And if you deal with chronic allergies, common colds, diverticulitis, irritable bowel, chronic fatigue, sinus infection, immune depressed conditions, you most likely have a combination deficiency. So what all do enzymes do that could possibly cause you to have all these symptoms? Well, in just a minute, I'm going to tell you.
Arthritis is a general term for several ailments of differing causes, including inflamed, thickened, painful joints. Vitamin C alleviates the pain associated with all forms of arthritis.
Well, I believe the answer to most arthritic pain and dis-ease likely revolves around enzyme deficiency. And enzyme deficiency can manifest itself in a variety of conditions, everything from bloating to mood swings to arthritis. Well, so let's talk about what do those enzymes actually do. Protease digests protein. Acidity is created through the digestion of protein. Therefore, a protease deficiency results in an alkaline excess in the blood. This alkaline environment can cause anxiety and insomnia. In addition, since protein is required to carry protein-bound calcium in the blood, a protease deficiency lays the foundation for arthritis, osteoporosis, and other calcium-deficient diseases. Because protein is converted to glucose upon demand, inadequate protein digestion leads to hypoglycemia, resulting in moodiness, mood swings, and irritability. Protease also has an ability to digest unwanted debris in the blood, including certain bacteria and viruses. Therefore, protease-deficient people are immune compromised, making them susceptible to bacterial, viral, and yeast infections, and in general, decrease in their immune system. Amylase, another digestive enzyme, digests carbohydrates along with dead white blood cells, which is pus. When you are low in amylase, you are a candidate for abscesses, inflamed areas with pus, but not bacteria. Amylase is also involved in anti-inflammatory reactions, such as those caused by the release of histamine and similar responses, so thus allergies. And amylase deficiency can result in skin problems such as psoriasis, eczema, hives, allergic reactions to bee and bug stings, atopic dermatitis, and all types of herpes. Asthma and emphysema may also be exacerbated by an amylase deficiency. Now, since lipase digests fat and fat-soluble vitamins and balances fatty acid, lipase-deficient people can be expected to have a tendency towards high cholesterol, high triglycerides, difficulty losing weight, and diabetes. Am I knocking at your door? The future outcome of these tendencies is heart disease, which kills 1 out of 2 Americans. Lipase-deficient people also have decreased cell permeability, meaning nutrients cannot get in and the waste cannot get out. The condition of vertigo, other diseases like Meniere's disease, dizziness aggravated by moments such as walking or driving and you get dizzy, can also result from lipase deficiency. Cellulase breaks down the fiber in our diet. This is another enzyme. Because our body does not produce cellulase, this food enzyme is essential. We must eat it or take it on a daily basis. Remember, only raw foods, not cooked, raw foods contain cellulase. Of all of the enzymes, this deficiency carries with it the most category of problems because people are not eating enough fresh, raw veggies. The symptoms of cellulase deficiency can be best described as malabsorption syndrome, impaired absorption of nutrients, vitamins, or minerals from the diet by the living of the small intestine. Malabsorption has many symptoms including lower abdominal gas, pain, bloating, and problems associated with the pancreas and other areas. The consumption of fiber-enriched nutritional drinks, which are full of cellulose, can exacerbate these problems. Sugary drinks are no-nos. Sucrase-intolerant people, this is another enzyme, cannot split the sucrose disaccharide into twin partners, 2 units of glucose. Glucose is a primary brain food, so expect mental and emotional problems in people who cannot get glucose into the brain. Symptoms include depression, moodiness, panic attacks. I don't think you're deficient in a drug, you're deficient in enzymes. Manic and schizophrenic behavior also related to this, and severe mood swings. Lactase intolerant people also have classic symptoms which include abdominal cramps and diarrhea. Other allergic symptoms including asthma have been witnessed from the ingestion of lactose-containing products. Another enzyme, maltase intolerant people are generally sensitive to environmental conditions. Bottom line, guys, we need enzymes. I'll be right back.
Yes, it was the first time that we've seen Valerie.
Oh, I loved it.
I thought it was excellent. Oh, it was very good. Oh, she was terrific. It was very good. Truly blessed.
I loved it. I enjoyed it.
She was very empowering, and she told us exactly what our body needs.
I'm 80 pounds overweight, and the Lord's been telling me for a long time, lose it, Bob, lose it, lose it. And today when I was sitting there, I said, okay, this is it. I'm going to do it. I'm going to do it. I'm going to read her book, which is out of right now.
Oh, yeah, because people need to know. It's like she said, the lack of knowledge. If you don't know, you don't do it. So, yeah, I'll share it with everyone.
To find out more information, log on to our website at ValerieSaxonMinistries.com. Capsaicin, 25,000% cream applied topically 2 to 4 times per day, alleviates the pain associated with osteoarthritis. Exposure to sunlight alleviates osteoarthritis by stimulating the manufacturing process of vitamin D.
Okay, you have arthritis. I first want to tell you there is hope. The best way to turn the tide is to do a cleanse. There is nothing like a 3-day fast to get you off to a good start. And I would highly suggest a 30-day herbal cleanse to get the bad out and put the good in. A diet high in fiber and fruits and veggies as well as sprouts is excellent. Avoid red meats and absolutely no pork. No mucus-forming products like milk, cheese, ice cream. No table salt. Go for the sea salt. And do like the Europeans. Eat your salad last. That will give you those living foods, which equals living enzymes to help break down the cooked foods. And by all means, start enzyme therapy immediately. If you have more questions, you can visit us at ValerieSaxonMinistries.com or you can call 1-800-493-1146 and I'll be right back and tell you more.
Let's see, potato chips.
Hey, Dan.
Hey, how you doing? Not bad. Just here cleaning out my kitchen pantry.
Cleaning out your pantry?
Well, I'm over at Dr. Val's house the other day. I'm cleaning out the gutters. You know, winter's over, got to get everything straightened up. I climbing the ladder and just kind of sore and stiff, and she's like, you know, what's wrong with you? So I climb down and I tell her, you know, I'm just achy all over, you know, my knees, my elbows, just sore. And she tells me I got to start eating right.
You're kidding.
No.
So what are you doing?
Well, she gave me a list of stuff. She says acidy foods can cause arthritis. So I have to get rid of all this stuff. My candies, my cookies. I mean, who doesn't like cookies, right? Turns out, it's bad for you. I gotta have a more balanced diet. Can't have no more of these. No more of these. No more chips. No more white bread. How are you supposed to make a sandwich without white bread, huh?
I don't know.
Mayonnaise. Mayonnaise. No more mayonnaise. Mustard's worse.
Oh, you're kidding.
No. But that's okay, you know? It gets worse. I can't even use any sweet and low anymore for my coffee. And it doesn't matter because I can't have any more coffee.
Oh, boy. This.
Oh, no. This is going to take a while. So you can't have any of that. Can't have any of that. Oh, I'm going to miss you. No more you.
Regular light exercise, especially aerobic exercise, is a recommended treatment for osteoarthritis. Excessive consumption of sodium contributes to osteoarthritis. This in turn accelerates the loss of calcium from the bones.
Well, I'm feeling so old, don't know what to do. I'm feeling so cold and I can't seem to move. I've got a feeling, hurts in my knee, my hands won't move. It's so hard to see, I've got those old arthritis blues. Well, I know I'm never young, and I know I'm growing old. The pain is getting me, it feels so cold. My fingers won't move, my knees won't do what they're told. I've got those arthritis blues, it hurts me so bad. These arthritis blues, you know the pain is driving me mad. I can't seem to go just out anymore. The pain and the misery, they keep me so sore. I've got those arthritis blues, just wanna lay